The work that I do uses anthropology as a model system for looking at ongoing public health problems, and currently we're focusing on sexually transmitted diseases. I'm Bradley Stoner. I'm a sociocultural anthropologist and a physician here at Washington University in St. Louis. I'm primarily a public health anthropologist. The issues that I work on deal with contemporary problems in community health. I've worked in Peru on alternative medicine use in the public health system there. I also work in communicable disease control here in the United States, primarily dealing with sexually transmitted diseases. So I work with public health officials at the local, state, and national levels on STD control and prevention. We have looked at sex partner networks, the ways that people choose partners and how that affects STD rates. For example, social and sexual networks seem to be much more closely aligned with chlamydia, which is a sexually transmitted disease more common in teenagers and young adults. Whereas with syphilis, which tends to be a disease of a little bit older individuals, the sex partner networks are not very well embedded in the social networks, which means that people are having sexual contact with others with whom they don't have much interpersonal interaction and knowledge. And this really affects our ability as a public health system to contact partners with regard to exposure. So one reason syphilis rates continue to climb is because of the difficulty in notifying partners because the sexual networks are distracted from the social networks. Chlamydia, we have an easier time contacting partners, but we don't have the staffing. Health departments are really suffering reductions in workforce, which is affecting the ability to control these infections. We're using anthropological approaches to interview and do in-depth ethnographic observations in clinic sites and in field sites with regard to STD prevention and care. And this means interviewing patients, but also providers. And so we work in clinical sites and do a lot of participant observation, which is a real ethnographic approach to the problem. We also use quantitative methods and survey methodologies to develop more nuanced understandings of STD distribution in society. And we try to merge those qualitative and quantitative approaches. So a lot of my work is collaborative. I'm working with epidemiologists, I'm working with social scientists and other disciplines, statisticians, biologists, to try to get a comprehensive understanding of STD epidemics and population-level interventions to help reduce the spread. STD control continues to be a moving target. Where we are right now is seeing an increased rate of syphilis that seems to be correlated with HIV transmission as well. In other words, kind of a co-epidemic of syphilis and HIV. So we're working with public health officials to come up with better strategies for testing for syphilis among HIV patients, but also testing for HIV among syphilis patients and intervening to reduce the spread of both infections at the same time. Meanwhile, gonorrhea and chlamydia continue to increase as well, yet they affect different populations. And so we have to look at STD approaches for teenagers, STD approaches for men who have sex with men, different groups suffering different conditions, different types of transmission patterns. I am continuing to work in Peru on alternative medicine use to understand integration of complementary and alternative medicine into the public health care system. One of my recent projects has been to work with colleagues to do a detailed inventory of the sexually transmitted disease clinics across the United States. And this is more complicated than it sounds because on paper you can do an assessment of a number of clinics in individual sites, but when you do an ethnographic validation of those sites, you find that many of them are not true STD clinics, they're not full service clinics, they're not operating 5 days a week, there are barriers to access of care in those sites. And so what you see on paper becomes very different from what is actually occurring on the ground. And this may also be contributing to the persistence of STDs in the population. So I see that as a fruitful line of research in the future as well.